Are you at risk for endometriosis? Alright everyone, so it's a new week and that means I'm giving you a brand new video, and if you've been paying attention for this week, I'm going to be looking through the risk factors of endometriosis for Endometriosis Month. So first of all, endometriosis is a condition that affects women where there is some growth on the uterus of tissue that shouldn't really be there, and this can lead to different symptoms, but mostly just having a painful feeling in the abdominal area for women. So this video is basically showing the women what risk factors can actually increase their chances of getting endometriosis. But if you're a man, don't click off just yet, because maybe you know somebody with these risk factors, you can share it to them just so they know that they need to watch themselves. So the first risk factor we're going to look at is age. So endometriosis affects women of any age. Once a woman is menstruating, she is at the risk of getting endometriosis, but it tends to be diagnosed for women in their 20s and their 30s. So around that range is where it tends to peak for women on average. The other risk factor is having it in your family. So if a family member had endometriosis, such as your mother, your sister, your grandmother, you are actually 7 to 10 times more likely to actually get endometriosis. And this is just kind of true for almost any condition, so it's important to know what your different family members have, just to know how likely you are to get that condition, in this case endometriosis. The next risk factor is starting the menstrual cycle at an early age. So your chances of getting endometriosis actually increases the earlier you started to get your period. And the age is about 11, so if you had your period before 11, then you're at a high risk for getting endometriosis. Another one is having short menstrual cycles, and they were saying less than about 27 days. So if you have short menstrual cycles lasting less than about 27 days, then you're at a higher risk for getting endometriosis. And the last risk we're going to look at is having a heavy menstrual period that lasts more than about 7 days or so. So having that also increases your chance of getting endometriosis. So if you realize you have 3 or more of these, it's best to go and talk to your doctor about the fact that, hey, I have these different risk factors. What are my chances of getting endometriosis? And so your doctor and you can talk about different things that you can do to prevent it. Or they can go ahead to do some tests on you to see if you actually have it. But in the meantime, here are some things that you can do to lower your chances of actually getting endometriosis. 1. Exercise. Try and exercise more, about 30 minutes of moderate exercise at least 5 or 4 times per week. 2. Eat more whole foods and less processed foods. 3. Consume less alcohol. And if you're on birth control, talk to your pharmacist about birth control that might have less estrogen in it, because estrogen can go on to cause endometriosis. Alright, so that's been a little video here on the risk factors of endometriosis. I hope you learned something. I hope you were reminded of someone, so you could send this video to them so that they can be on the watch and alert for this condition. Thank you so much for watching. If you have any more questions, just comment them, or you can DM me and I'll try to answer them as best as possible. Also, I'd love if you could share this video around. It really helps out a lot. Thank you so much for watching this video this week, and I really hope to see you next week again.